New York has lifted many of its coronavirus restrictions, but there's controversy because some public events are only open to those who've been inoculated with certain makes of vaccine. People attending recordings of television shows such as Saturday Night Live and The Tonight Show, for example, are required to have had a US-approved vaccine, which does not include Astra Zeneca. So is this a new kind of vaccine nationalism? Let's speak to Professor Lawrence Gostin, who's director of the WHO Centre on Public Health and Human Rights. And this professor hit the headlines when the Bruce Springsteen on Broadway show initially decided to not allow those vaccinated with AstraZeneca to attend, and then has since changed its mind. But it does broaden the question out to whether we are seeing a preference of which vaccines people are getting.
Yeah, I mean, the truth is, I mean, it's a good news, bad news scenario. I mean, the good news is that I think that requiring proof of vaccination, which hasn't really taken off much in the United States, makes these concerts and venues so much more safe. But the bad news is that you have to ensure that any good vaccine qualifies, and the AstraZeneca vaccine is a remarkably good vaccine. I mean, approaching 80% effectiveness and nearly 100% against really serious disease, and also it's actually the most used vaccine in the world by far, used in 178 countries, and so places like Broadway are quintessentially international venues, and to exclude, people from the UK, the European Union, Canada, it makes no sense. There's no good scientific reasons for it at all.
But it's not been approved by the American agency, the approval agency, the FDA. So where are we when it comes to AstraZeneca in terms of its progression through that path?
It's unclear, whether and when AstraZeneca will get US FDA approval. Probably the real reason for that is that, right now the United States, has 3 vaccines in its arsenal. A 4th one is coming up with the Novavax vaccine. And so we don't have particular use for the AstraZeneca vaccine. And also, with the regulatory pause on AstraZeneca, same thing happened with Johnson & Johnson. There's a reluctance, in the United States, and there's kind of the public opinion that it's a second-tier vaccine, which of course it's not. So I wouldn't be surprised if AstraZeneca didn't even demand emergency use authorization, but went straight for full approval, or what we call full licensure from the FDA later on in the year.
But then when it comes to people who have had that particular vaccine, myself included, what do you say to them if somebody who has had or is thinking about getting the AstraZeneca vaccine, they start getting concerns about it?
Well, they shouldn't get concerns about it. It's a remarkably good vaccine. Its safety profile is excellent. Its effectiveness, not just as efficacy in clinical trials, but also in real world. It's being used in 178 countries. I would just reassure the public that AstraZeneca is an extraordinarily good vaccine, and the United States should do the same. I mean, I've been asked by universities, we've got over 100 universities in the United States that are mandating vaccines, and the question is, which vaccine should qualify? It may not be that you want to allow say a Sputnik 5 vaccine from Russia, but if you've got a vaccine like AstraZeneca that's been approved by stringent regulatory authorities and has received authorization from the World Health Organization, it literally makes no sense to exclude a large swath of the world's population.
Professor Gostin, always good to get your expertise and your calm response to this from the WHO. Thank you so much for your time and your expertise. Thank you.